Greetings, everyone, and welcome to today's Emergency Rural Healthcare webinar. Thank you for joining us today. With that, I'd like to now introduce and turn the presentation over to Rural Development Chief of Staff, Farah Ahmad. Farah?
Thank you so much. My name is Farah Ahmad. I'm the Chief of Staff for USDA Rural Development. I want to start off by just thanking you for taking the time to be here with us today to learn more about this amazing program. The Biden and Harris administration's historic emergency legislative package, the American Rescue Plan, is changing the course of the COVID-19 pandemic, and it's providing immediate relief to millions of households and building a bridge towards economic recovery. And the administration is also taking action to improve the health of rural communities by making millions of dollars in the American Rescue Plan available to meet immediate COVID-19 needs in rural communities. Now, last month, Secretary Vilsack announced the $500 million in the American Rescue Plan for the emergency rural healthcare grants. That's why you're all here today. And the purpose of this is to really help rural healthcare facilities, tribes, and communities expand access to COVID-19 vaccines, healthcare services, nutrition assistance, and other types of long-term sustainability. And this funding will do two critical things: expand rural hospitals and providers' access to vaccines, testing, and supplies, but also helping rural healthcare providers stay financially solvent in the long term. So these grants are being distributed through two different funding tracks: the recovery grants and the impact grants. Today, you'll be hearing about the second track, the impact grants. And these grants are divided into two pots of money: $350 million for the recovery grants and the $125 million for the impact grants. And what these impact grants will help do is develop regional partnerships or consortia to engage in large-scale projects to support long-term sustainability and access to healthcare. This second track is fundamentally different from the first one and is really focused on healthcare as a great economic driver and a critical asset for rural communities. And the department has heard from partners and stakeholders regarding the critical needs facing rural healthcare. These include things like developing integrated healthcare models, reducing the tendency for rural residents to bypass local hospitals to seek care in urban facilities, expanding telehealth, electronic health data sharing, workforce development, transportation, paramedicine, and supporting healthcare as a small community or anchor institution. And we heard these needs, and we really hope that the impact grants will play a part in furthering those activities and supporting rural healthcare. You'll hear more about the details about these impact grants, and we really want to thank you for joining to learn more about them and for your patience. This is a new program, and so we really welcome questions from you as we're all learning together, and your questions will help us better understand the kinds of information that will be most useful to you as you think about applying for these funds. So again, thank you. Please ask as many questions as you want. We're here for you, and we look forward to working with you. And with that, I'll hand it over to Chad Parker, our Acting Rural Housing Service Administrator.
Thank you, Farah. And thanks to everyone for taking the time to join us this afternoon. I appreciate everyone just being engaged in this program and all of the great questions and responses we've had from the rural community with regards to this effort. It makes me feel like the word's getting out there and that we're going to get a lot of impactful applications in. So on today's session, we're going to primarily focus on the Track 2 impact grants, which, as everyone knows, is a component of the emergency rural healthcare grants. Some of you may have participated in our previous webinars, so these beginning few slides may look a little familiar. Please bear with us. For those of you who have not participated in our previous webinars, I'm going to give a brief overview of the agency and let you kind of know what USDA Rural Development is and what we're working on and how we became engaged in the emergency rural healthcare grants. So rural development offers more than 40 loan, grant, and technical assistance programs to support economic development across rural communities. They're broken down into these broad program areas: telecommunications, electric programs, community facilities, our water and environmental programs, business cooperatives, single-family housing, and multifamily housing. We support just all kinds of economic and community development, broadband infrastructure with funding that provided out in loans, grants, and loan guarantees. My area, especially the place I'm work with, is the community facilities program. All told, across USDA Rural Development, we invest about $28 billion each year, and our total portfolio consists of $250 billion. For the community facilities program, we have about a $12 billion loan and grant portfolio, and about half of that portfolio, there's about $6 billion of that is invested into rural healthcare projects, rural hospitals, rural clinics, county health departments, mental health care, oral health care. So a diverse array of healthcare facilities. So USDA, through its 40 programs, the way we're operated is we have 47 rural development state offices. And in each one of those state offices, there's a rural development state director, and there's also a rural development community programs director. As you're working on your emergency rural healthcare grants, I would certainly advise that you become familiar with your rural development state office, our rural development area offices, if you have one located near you. But start a conversation with the rural development state director and our community programs director. They will be able to assist with your questions as you work through the application process. As you learn more about the program, as you engage with our state office, we're also available through our community facilities email website. There you see it at the bottom of the slide, to also provide feedback if you have questions. We're taking those questions that come in, answering them, sending an email back out to the organizations that ask the question, and trying to get those questions up on our frequently asked questions site. I think we've got about 800 questions in the queue. I think we've answered around 400 of them. So we're working on the questions and the responses and making sure we get those back out to you as quick as we possibly can. Before we start talking about track 2 of the emergency rural healthcare grants, I think I'd like to highlight kind of what we do in the community facilities program. What we do is we get about $2 billion each year in direct loan funds, about $500 million in guaranteed loan funds, and $30 million in our typical community facilities grants program that we provide out across rural America in towns of 20,000 or less to go into a broad array of community facilities. Hospitals and healthcare clinics make up about half of our portfolio, but we also do colleges and K through 12 schools, daycare facilities, a lot of public safety, public facilities, town halls, the community visitors and welcoming centers, the community administration building. So vast array of facilities and a lot of effort across the country in making sure those funds get out the door. On our emergency rural healthcare grants, we are basically have introduced that program. It came out, the Secretary Vilsack on August the 12th did a introduction of the program at a facility in Minnesota. And also we had the notice come out on the Federal Register, on August the 12th. So that notice is up and available on our website, and it describes the 2 tracks of funding. The Emergency Rural Healthcare Grant Program offers, going to offer $300 million through track 1. We'll distribute those funds through our rural development state offices. What we refer to as recovery grants are the track 1 grants. The range for those grants is going to be between $25,000 and $1 million, and it's going to support immediate rural health care and nutritional assistance needs as a result of the pandemic. RD is going to be able to support things like cold storage for vaccine, medical supplies and PPE, telehealth equipment, construction and renovation of healthcare facilities, covering some lost healthcare revenues due to the pandemic, and staffing for vaccine and testing, and supporting food banks and food distribution facilities. We understand that that current healthcare needs are certainly a wide variety. So we had small rural healthcare clinics come in and say, hey, we need things like equipment for vaccine storage. But we had much larger facilities come in and say, hey, we're going to end up having to renovate our facilities due to the pandemic to allow for better patient flow, or we're going to have to do HVAC upgrades. That's why you see such a large differential between that $25,000 and $1 million in grant size. If you're interested in learning more about Track 1, we've got on our webpage, if you Google up emergency rural healthcare grants, or actually the website's right there at the bottom of the slide, but you can also Google it up, and it's there. What we've got on that webpage, we've got a lot of great information, a link to the notice and that type of thing, but we have the slides and the recording from a previous webinar that we've done that primarily focused on the Track 1 recovery grant. So we want to encourage you, if you're interested in the Track 1 recovery grants, to go out and look at that webinar as well. For Track 2, what we refer to as the impact grants, the range is going to be between $5 million and $10 million. And those funds are going to be for regional consortiums or networks of entities to work together to solve specific regional healthcare problems to support the long-term sustainability of rural healthcare. What we're looking for are models to increase the rural healthcare outcomes, ways to increase the availability of healthcare services, or help ensure that a local hospital or clinic remains an economic driver in its rural community. So during today's session, we're going to focus on Track 2, and here's kind of the chart, the agenda for the rest of the webinar. We're going to walk through award purposes, we're going to talk about program eligibility, the review criteria, we're going to talk about submission information, and then what the Q&A is going to be done throughout. So we're going to stop intermittently, take a look at the questions that you're putting up in the chat box, and try to answer as many of those as we can on the webinar. So I'm certain already, we've already got a lot of questions coming in. We'll add those questions also to our queue. We'll put them up into our frequently asked question box as well. I did want to touch on it here. The reason that we decided that we needed to come out and hold a Track 2 webinar is we've had a lot of requests that have come in looking to take a large construction project, construction of a critical access hospital, construction of another large healthcare facility, and kind of fit that into an application for a Track 2 impact grant. We want to make sure that everybody understands that the primary need that we were looking to fill is to develop models for rural healthcare, so that we take a problem that is out there in the rural healthcare region, in a region that's impacting a region that's a rural healthcare problem, and this consortium of diverse entities comes together, maybe a university, maybe the county health system, a couple of hospitals, some clinics, maybe a community college, and they come together as a consortium of entities, maybe certainly tribal entities as well. They come together to find a pathway working together to solve that healthcare problem. And then we're going to take that plan and model that they put together, and then their evaluation method, and package that up. And when we have a successful model, what we want to do is provide that out to the rural healthcare sector, and make people aware through our friends at HHS and the other rural healthcare technical assistance resources associations that are out there, but make people aware of those models so that they can be replicated in other rural areas to solve those problems. So I became a little concerned that what we were seeing is a $20 million construction project that people were going to try and fit those into the Track 2 applications. As we go through, I think you'll be able to identify that it's going to be hard for those types of applications to score very well. You very much want to look at developing a model, having a plan for solving a rural healthcare problem, and then integrating diverse resources to solve that problem. So I think now I'll turn it over to Jamie. Jamie Davenport has been just the star of our emergency rural healthcare grant program, the person who's helping to put together all the information and our notice, very familiar with everything that we're doing. We're going to turn it over to Jamie, let her start walking through the slides, and then I'll come back and answer some Q&As. So over to you, Jamie.
All right. All right. Thanks, Chad. We're going to stay on that last slide for a second. I wanted to touch on that before we move on. So under track 2, as both Chad and Farah mentioned, we are seeking to fund projects that establish a model to advance ideas and solutions to solve rural regional healthcare problems that impact the long-term sustainability and availability of rural healthcare. With the help of a consortium of partners that are collaborating together, the track 2 applicants are going to be expected to do these things that are here on the screen. They're going to be expected to identify a specific regional healthcare need. Some examples that we've heard about include, it could be related to, for instance, maybe the prevalence of diabetes in a community and how the community is putting together a plan to combat that. It could be a need for more integrated telehealth practices, a need to provide obstetric services in an area that has either lost or is at risk of losing those services. Those are some of the examples of regional healthcare needs that we've heard about. But Track 2 applicants will be expected to identify that need. We're also expecting Track 2 applicants to identify expected outcomes and aims of the proposed project, to identify and then actually implement the steps necessary to further the project, and importantly, to evaluate the project's progress and success toward meeting the program goals to support the long-term sustainability of rural healthcare. So we are interested in identifying projects that can potentially be replicated in other parts of the country. We're interested in identifying some innovative approaches that need this extra boost in grant funding to test methods and solutions to potentially change the landscape of rural healthcare for a region. And we're also interested in sustainability. So how does the work carried out under this grant continue after grant funding is no longer available? Those are some of the factors we're going to be looking at when we're reviewing the Track 2 applications that we receive. We have $125 million in available Track 2 funding. Unlike our Track 1 funding that will be allocated to the USDA Rural Development State Offices to fund projects, this Track 2 funding, the $125 million, will remain in our national office. And Track 2 applicants are going to be competing with projects located around the country. With the size of these grants ranging from $5 to $10 million and the amount of funding we have available, we anticipate awarding up to 10 or 15 projects nationally. So just wanted to kind of provide some of that context here before we jump into more of the eligibility and use of funds. So if we go on to the next slide, we mentioned we're looking for Track 2 applicants to propose a model or project that responds to a particular rural healthcare need. This slide here just shows some of the significant health topics that we've heard raised again and again from stakeholders, from participants in our webinars and other events like these, as issues that are impacting access to and availability of rural healthcare, and that might benefit from funding or might benefit from a project that can be funded under this program. We're encouraging but not requiring applicants to choose from these topics. We're just providing them as examples for you. There were a couple additional topics here I wanted to highlight. The first is related to the development of integrated healthcare models. That's referring to integrating behavioral and primary or specialty care together. That's what we mean by the integrated model. Also wanted to highlight reducing facility bypass. That means getting rural residents to stay with care with their local hospitals rather than immediately going to the more suburban and urban hospitals. So if we go on to the next slide, Taylor, Through this funding, we're interested in identifying these successful models for tackling these types of problems, and then how we can share and raise awareness so that other regions can consider replicating if it's something that might make sense for their region and the particular needs and challenges of their region. So on the use of funds, applicants may use the grant funds to help identify or narrow down on the specific healthcare needs. They can use the funds to set up a model or plan to tackle that need, to implement the plan or model, and then to provide an evaluation model down the road to determine whether or not that model was successful. Applicants are able to use the Track 2 grant funding for things like personnel costs, could include construction costs, equipment, technical assistance, or indirect costs to help carry out the eligible activities that are listed here on the screen. And I do want to go through some of these. The first is that funds may be used to establish or scale a consortium of partners to plan, implement, and evaluate a model to support solving a regional healthcare need and long-term sustainability. The consortium, it could be an already existing consortium that you participate in, or it could be a new consortium that is established because of this project. Next, funds may be used to establish or scale an evidence-based model and disseminate lessons learned. We want what is developed here through help of this program to potentially be helpful to other communities and healthcare partners that might be facing similar challenges, as I mentioned earlier. Item C on the screen here, the funds may be used to identify a health-related problem, develop and implement a method and solution, and then to conduct an evaluation of the model's success. So we think that develop and implement a method and solution is really going to be one of the key aspects of an applicant's project proposal, and then a significant amount of funds would go toward that development and implementation of the model. The next item, D, the funds may be used to support the establishment of a methodology to calculate the return on investment or summary impact measures that come out of this work. We recognize that some applicants may need assistance with the evaluation techniques for that return on investment or those summary impact measures. So data collection or really any other aspect of the project, applicants can request technical assistance funds to help cover those types of activities. So we included technical assistance funds as an eligible use under the grant. Next, the indirect costs funds may be used to cover an applicant's indirect costs up to their approved indirect cost rate from a cognizant federal agency. And applicants may make subawards with these funds, whether it's to other consortium members for work that's conducted under the grant or other partners that are providing services related to this grant. And finally, applicants may use a portion of the grant funds to cover certain professional service fees and charges. So this would be for things like a project architect, an engineer, environmental consultant, or legal counsel. These are only allowable when, under certain circumstances, they must be a necessary part of the project, a small part of the small portion of the grant, and only when reasonable and customary for the type of project proposed. So selecting the professional, typically it must be done through a competitive procurement process. So if your project will include these types of costs, then I recommend looking closely at the NOFA to be sure that you meet the requirements here for this item. Again, applicants can use the grant funding to cover the cost of personnel to carry out these activities. They can also use funds for the purchase of equipment, technical assistance, and construction costs to help implement the model that's proposed. Next, we want to look at the ineligible use of funds. So this slide highlights the ineligible uses. We cannot fund any expenses or losses that have been reimbursed from other sources or that other sources are obligated to reimburse. This is particularly relevant for the Track 1 applicants that may have received other COVID relief funds, whether it be from SBA, HHS, or other federal or state sources, but also important here to note as well for the Track 2 applicants. The next item is related to salary, and we've received a lot of questions about this limitation. If you are requesting salary for personnel costs, the request may not exceed an annual salary of $100,000, and it has to be prorated for the time period that you're requiring, that you're requesting assistance. So as an example, if you're requesting salary costs for someone who makes more than $100,000 annually, that's fine, but you can only request funding to cover the first $100,000 of that person's salary. We can't fund above and beyond that level of salary. And the limitation here, some folks have asked whether it means that there's a limit or a cap on personnel of $100,000 total. That is not the case. We're looking at $100,000 per individual. It's not an overall cap on the award. So I hope that answers some of those questions. Next, this program does not allow for any construction or renovation of facilities in non-rural areas. So facilities benefiting from this assistance, those facilities must be located in rural areas with populations of 20,000 or fewer residents. We've gotten a lot of inquiries for asking about facilities that might be located in more suburban locations, that have high needs. But our program, the way the law is written, is very specific that these grant funds are to support facilities in rural areas of 20,000 or fewer residents. Next, the grant funding may not be used for the purchase or acquisition costs for facilities or property. So we cannot cover those types of acquisition costs. That's another common question we've heard. Next, on refinance. Refinance is typically not allowable, although there are some potential exceptions, particularly for Track 1 for COVID eligible expenses incurred during the pre-award period. So I see that more as a Track 1 issue, less so here, but I could be mistaken. And next, applicants cannot request funds before the pre-award period, which begins March 13th, 2020. We're not able to fund any eligible activities that occurred before March 13th, 2020. And we cannot fund any activities after the 3-year grant period. So this is anticipated to be, the grant award period depends on the project that you're proposing. But we are offering up to 3-year grant periods. With the Track 2 grants, I believe we estimated that those grant periods would begin January or February of 2022, and so the project could potentially go up to 3 years beyond that. And then finally, ineligible uses, any purpose that is prohibited in the federal grants regulations in 2 CFR 200 to 400. Any of those ineligible purposes are also ineligible under this program. So we want to pause here, I think, and look and see what questions that we've received, what we can go over, particularly related to kind of the purpose and use of funds. Chad, have you found some? I think we have plenty of questions to choose from.
We do have plenty of questions. I tried to separate out some that are kind of focused on award purpose to begin with. So first question, can Track 2 awards be used to fund telehealth equipment? So I think yes is the answer to that question. If the applicant demonstrates a regional healthcare need for the additional telehealth services as a part of that implementation plan for a Track 2 award, you could absolutely include the purchase of telehealth equipment, electronic health records, data sharing equipment as a part of a Track 2 award. So next question, can a nonprofit hospital under Track 2 hire consultants for short-term projects with funds from the grant? Projects such as establishing electronic health records, EHR, that we are having difficulty with doing, hiring a program manager to assist with the planning and renovation of a new facility. So I think the answer is yes to this as well. Under Track 2, you can cover the cost of technical assistance, of professional assistance to come in and help with different aspects of the implementation of that project or the evaluation. So covering the cost of those consultants would potentially be an eligible cost. There is a section that we have in the notice on eligible costs, and it differentiates which professional service fees have to be competitively bid and which ones can just be hired. So the next question, will the impact grants fund retroactive programs like a vaccination clinic that we did earlier this year? Vaccines were provided from a federal stockpile, but they were not provided funding to administer the vaccines. So I think retroactively, I'm having a hard time thinking about how that would fit into the implementation plan for a Track 2 grant. I would say absolutely eligible under Track 1 and would encourage the applicant to consider Track 1 for that request of funds. Next question, are staffing costs an eligible use of funds for Track 2 as well as Track 1? If it is, does the staffing have to be related to vaccine or testing like in Track 1? So the staffing costs under Track 2 are to carry out proposed activities under that eligible uses of funds for the Track 2 award. So if you're set out your implementation plan and your implementation plan includes bringing on somebody who's going to be looking at differentiations of care across multiple facilities, and there's a staffing cost associated with bringing that person on, that staffing cost could be part of Track 2 application, and it doesn't have to be directly related to the vaccinations or testing as it would be in Track 1. Next question, could Track 2 funding be used to support a healthcare center in an urban area that is surrounded by dispersed rural communities? That the hospital encourages these dispersed rural residents to seek care at the nearest hospital. So I think you're asking, could the Track 2 fund awards be used to do renovations or equipment, potentially services out of a urban facility? So no, any of the facilities that the funds are going to be utilized for renovation, equipment purchases, funds that are going to be utilized at that facility, it must be located in an eligible rural area. So Track 2 question, does the applicant find the Track 2 model, or is there a model already created? So the applicant identifies a problem out in a rural area. I think Jamie earlier listed a large group of problems. There's some listed in the notice. Certainly applicants can identify whatever type of rural healthcare problem that's occurring in their region that they would like. And then the applicant develops a model for solving that problem. And in that model, they tell us, here's how we're going to utilize the grant funds across this group of eligible uses. And they identify how the funds are going to be spent, and then an evaluation model for deciding whether or not that plan was successful in solving the regional healthcare problem. So definitely the applicant develops the model. What is the funding period for the second track? Both Track 1 and Track 2 grants are offered up to a 3-year grant period. So there's a 3-year time frame once the grant funds are put in place that the applicant has in order to utilize the funds.
All right, Chad, I think we better, just looking at the time, I think we better keep going. We did have a couple questions that we've been getting frequently that we put up on the slide. If we go to the next slide, Taylor. I want to see if this is a question that came up, I think, in our last webinar. So Chad, maybe if you could help us, what connection to COVID-19 must the Track 2 applications have?
So I think we got a pretty good explanation here. Since the Track 2 applicants have to kind of define out how they're going to support the long-term sustainability of rural healthcare, defining their project, defining how it improves access to healthcare and healthcare outcomes and the economic vitality of rural healthcare. You've got a pretty broad array of purposes that the Track 2 funds can be used for. And it's broad across healthcare. And the way I look at it is the pandemic has had a dramatic impact across the whole healthcare sphere. So I think we can relate the pandemic to about at least the vast majority of healthcare services that are being delivered across rural America. So all we're asking is that in the application that you describe how this project relates to the pandemic. You don't have to have this specifically be related to COVID healthcare, to like vaccinations and testing and those activities. It can be for diabetes, solving the diabetes problem in a rural region. But certainly explain in your application as you're developing it how diabetes in that regional healthcare, as a regional healthcare problem, has been impacted by the COVID-19 pandemic.
All right, and this next question you've touched on already. Is rural development placing an emphasis on construction activities for Track 2 funding?
So an emphasis, I like the way I think that's the important part of the question. Like I said, they're going to go out and identify that need. They're going to put together, the applicant's going to put together a plan and an application, the steps that they're going to take to solving that need, and then they're going to evaluate it. So construction could absolutely be a part of one of those implementation steps. Renovating a clinic, reorganizing a rural hospital, doing some construction as part of that, adding on a set of service facilities. That can absolutely be a part of a project. But it's not I wouldn't call it an emphasis on construction activities. I think it's going to be very hard if you have a $15 million project, a $10 million grant request, and you're looking at $14 million for the construction of a large rural health clinic or a small rural hospital. That's going to be hard to score very well, or hard to identify that plan and steps if it's primarily a construction project.
All right, thank you. All right, let's move on. I see a lot of questions in the chat that we'll address here in these coming slides. So, oh, I forgot one more question. What professional service fees and charges may be included in a Track 2 grant request? So I went over some of these in the use of funds. Chad, do you want to?
Sure. We've had this question quite a bit as people are working on their applications. I kind of touched on it earlier. There's the category we certainly can cover. The consultants, professional service fees to come in and assist with necessary parts of the facility or the project as part of the emergency rural healthcare grant. There's a requirement that it's a secondary part of the funds. We will take a look at it and make sure that the costs appear reasonable. The piece that's important, I think, is the professional service provider that's selected through a qualification-based process. So you either go through a review of their qualifications, get multiple people in, or it needs to be a project architect, a project engineer, an environmental professional, or a legal consultant. There are some, a lot of healthcare facilities, consortiums are already working with some of those and are comfortable with those partners. We understand that. Certainly, if you're going to continue to work with this project with one of those consultants, that's okay. Other people, you need to go through the qualification-based selection process. The one thing I do want to bring out here, we've had a lot of questions about loan origination costs, grant writing fees, packaging fees, those types of things as a part of this project, especially when they're coupling a community facilities direct loan along with the emergency rural healthcare grant as part of the plan. The grant funds cannot be used to cover packaging expenses, origination costs, grant writing fees, loan consultant cost.
Right. Okay, let's move on now to talk about eligibility. So like in our regular community facilities program, eligible applicants under this emergency rural healthcare program include public bodies, nonprofits, and federally recognized tribes. And these organization types are the same regardless of which track of funding an applicant is requesting. For public bodies, these can include municipalities, counties, districts, or authorities. For example, a county-owned healthcare facility or local healthcare district can be eligible applicants. State public bodies are not an eligible applicant. And we've had some questions from state public universities. State public universities are not an eligible applicant under the program. Public universities can participate as a member of a consortium under Track 2, but they cannot be a lead applicant. Some public universities have separate entity hospitals. If these hospitals are separate nonprofit entities with a board that operates independent of the state, then those may be eligible applicants under the program. But the state public universities themselves, they are not an eligible lead applicant under the program. On the next slide, we're going to talk more about the requirement to have a consortium under Track 2. Track 2, oh, I'm sorry, let's go back real quick. Track 2 requires applicants to establish a consortium of stakeholders to undertake the work that's proposed here. The consortium members must be one of these eligible entity types: public bodies, nonprofits, and federally recognized tribes. Across all of our CF programs, our community facility programs, and this emergency rural healthcare program, nonprofit applicants have an additional requirement to demonstrate significant ties with the local community. This is to ensure that the nonprofit carries out a public purpose and that it will continue to primarily serve rural areas. Under Track 2, a nonprofit lead applicant does not necessarily have to demonstrate those significant ties on its own. A nonprofit lead applicant under the Track 2 can demonstrate these ties to the rural community as long as at least 2/3 of the consortium members are located in a rural area and primarily serve a rural area. So we'll be sharing this a couple more times here as we go through the presentation. Because we look at the consortium as a whole to demonstrate those ties to the community, the rural community, it means that the nonprofit applicants do not necessarily need to be located in or headquartered in a rural area. We may have Track 2 lead applicants that are located in an urban area. We may see nonprofit applicants that operate on a regional or larger scale that are partnering with local communities on a project that's targeting a particular rural area. On the next slide, let's go to the next slide to talk more about the requirements of the consortium. The purpose really of having the consortium to participate in these Track 2 awards is to encourage a diverse set of stakeholders coming together to tackle and solve a particular healthcare problem by creating and implementing a model that can impact the long-term sustainability of healthcare in that region. So we're really looking here to see applicants that are bringing together a diverse set of stakeholders. It might be a hospital that's partnering with a nonprofit, a college, and a town, for instance. But we're looking for a diverse set of stakeholders that comprise that consortium. The consortium must consist of at least 3 or more entities. They can be rural or urban, as long as at least 2/3 of the members are in a rural area and serve a rural area. One applicant must be the lead entity. We're calling that the lead applicant. That's our primary applicant. This will be the entity that will receive the award, and it has to be an eligible entity to receive an award, such as a public body, a nonprofit, or a tribe. The state university, I mentioned the state public university earlier. The state university cannot be the lead applicant. It can certainly be a member of a consortium. I mentioned earlier the lead applicant does not necessarily need to be located in a rural area. It can be located in an urban area as long as at least 2/3 of the consortium members are in an eligible rural area of 20,000 or less and primarily serve rural areas. Go to the next slide, we can talk more about rural areas and what we mean by rural under this program. So there are 2 components to determining what rural areas are eligible under this program, and that's population and income. For population, the facilities must be located in and primarily serve rural areas with no more than 20,000 population based on the 2010 census. So this means cities, towns, and other census designated places with populations of 20,000 or less. Primarily served means that at least a majority of the population within an applicant's service area must be in eligible rural areas. So at least 51% of the population that an entity serves must be located in rural areas. For the population data source, we're working from the 2010 census. Some high-level 2020 census data came out recently, but it does not include the localized data that we need. That's not yet available. So we're continuing to operate under the 2010 census. Now for income. In addition to the population requirements, we have to look at the median household income of the population to be served by the facility. And that median household income must be less than either the poverty line or 90% of the statewide non-metropolitan median household income. For the MHI data, we use the 2010 5-year American Community Survey data. And I know we've had a lot of questions about those data sources. So we've put those data, the links to those data tables on our frequently asked questions on our webpage. I also have it linked in this slide here in another couple slides. I'll share that. We're providing the data sources for you, but really I can't encourage you enough to reach out to your USDA Rural Development State Office as soon as you can to help determine whether your project meets the income requirements. So our state office will do the calculations to determine the maximum grant percentage that your project may qualify for. The amount of the grant that we can provide depends on the population and MHI of the service area. So smaller communities with the lowest MHI are eligible for a higher proportion of grant funds. We have had some questions about Track 2 applicants with multiple facility locations. If you're a Track 2 application, if you are proposing to serve multiple facilities, in that case, we're going to look at the MHI and the population for each of those facilities and determining the maximum percentage of grants that you qualify for. It does start to get complicated, so again, encourage you to work with your Rural Development State Office as soon as you can. The next slide is on cost sharing. So in this program, like in our regular CF grants, we can fund up to 15 or 75% of the total project cost. And that applies whether we're talking about Track 1 or Track 2. And applicants must provide other sources of funds for the remaining project costs. So I want to give you an example. In this first bullet here for a 75% grant, this would be for a project that's located in a rural community with a population of 5,000 or less, and the facility is serving a population with MHI that is less than the poverty line or 60% of the state non-metro median household income. That project is eligible for a grant up to 75% of the total project cost. The applicant must still raise or identify other funding sources for the remaining 25% of the project cost. We have an example. If we go to the next slide, we wanted to provide an example for maximum grant percentages relate to the grant amounts and the total project cost. So this table looks at both the minimum and the maximum grant amounts and shows you the minimum amount of cost sharing that applies whether you're eligible for up to a 75% grant or you're eligible for up to a maximum 15% grant. So for an applicant that may qualify for up to a 75% grant, in order to meet that grant minimum of $5 million, the applicant needs to demonstrate at least $1.7 million in cost sharing and a total project cost of at least $6.7 million. So that's for the minimum of a $5 million grant. So I think this is important context as you determine whether the project you're considering might meet that $5 million grant award minimum. If your project does not meet that $5 million minimum, then it's not eligible under for the Track 2 assistance. All right, so I want to move on to the cost sharing requirements, and I know we're kind of running on time here. So I want to cover what can be used as cost sharing funds. Applicants may not use RD grant funds. Our programs don't allow us to use RD grant funds as cost sharing. But you may be able to use other federal or state resources if it's allowed under the other program. So if you receive funds from another federal agency and are considering whether it might be an eligible match, we don't have a prohibition against using that, but you need to reach out to that other federal agency to determine whether they have restrictions on their program. The cost sharing or matching funds must be identified at time of submission. It doesn't mean that it has to be in hand. We'll be verifying the matching funds are in hand or firmly committed prior to awarding a grant. And we're also going to be verifying the matching funds before any grant dollars. All right, if we go to the next slide, I want to skip the questions, Chad, and we'll get through everything. So let's go to the next slide. Again, this here covers the definition of rural. We're looking at projects that are located in cities or towns of 20,000 or fewer people. I do want to point out an applicant's total service area population may exceed the 20,000, but the majority of the population must reside in rural areas. So it could be multiple rural towns that could exceed 20,000. We go to the next slide. This just shows you the data sources that we're using for population and MHI. So again, these are on our website that you can go to, but also, work with your Rural Development State Office. We're providing these for informational purposes, but you need to work with the Chad. If we go to the next slide, we can start talking about the review criteria.
Yep.
Okay, one more slide.
So our review criteria here, these are the things that we're going to consider when rating the applications for Track 2. We'll be using a mix of kind of objective and subjective criteria. If you look at them, the first, I think, 5 are pretty objective criteria. It's going to depend upon the location of the facilities or the service area of the application that we'll be going through. So the majority of the points are around the rural healthcare problem, the subjective criteria, the need, methodology, innovation, organizational capacity and strength of the consortium, work plan and proposed budget, the evaluation, the impact and ability to duplicate. The reason I think the important part of this is take a look at the points. We've got 35, 40 points that are related to objective criteria about where it's going to be located. And we've got 60 points. The vast majority of the points are related to the evaluation of that plan implementation, that model, the evaluation method that's going to be used. So that's why it kind of goes back to saying if we're looking at just a construction project, it's going to be hard for that type of project to score out. So I just want to make sure that as people work through these applications, that they're working on an application that has a good chance of meeting the intent of the program and scoring well to be able to compete for funding. So I think that's the primary item that we can take from here.
Yep. And if we go into the next slides, you all have access to these slides as handouts, and we're also going to put it on our website. But each of these subjective rating criteria, the NOFA application guides and checklists are all designed to walk you through each of these categories and you know, the items that we are going to be evaluating when we're scoring these applications. So the first section here on the need, methodology and innovation, we're going to be looking at the extent to which an applicant is describing an innovative strategy to address the needs and goals, and the extent to which the project will provide impact to the community. On the organizational capacity and strength, we're going to look at the roles and responsibilities of each consortium, what does each partner bring to the project, and what's the relationship of that consortium to the rural service population. Then on the next slide, we talk about work plan and evaluation. So we're going to be looking at the work plan and budget to determine whether it's reasonable in light of the project's goals. And also look at our review panelists will review the proposed framework for evaluation of the project. So we wanted to share that, point that out so that you're sure to look at the application guide and the NOFA to look at these review criteria as you're putting together your application. If we go to the next slide, more information. We have on our webpage the guide, application guide and checklist that I mentioned are available on our Track 2 webpage. And if you're interested in applying, you know, we can't emphasize enough reaching out to your state office now to start talking about that application to determine your grant eligibility. Chad, do you have any other closing remarks to share?
We had a ton of questions that I would have been able to try and start to answer. So we'll get answers out to everyone on our frequently asked questions list. What I did want to say is, as you take a look at those criteria that Jamie had just showed, it's not, we're going to bring in people who have a good, strong healthcare background. People, hopefully people who work at HHS or people who got a long-term experience in different rural healthcare fields to be able to review those portions of the application. So I just want everybody comfortable that it's not Chad and Jamie who are not healthcare experts that'll be reviewing that. We are going to make sure that it gets out to outside reviewers that have a good level of expertise in these fields to be able to go through and look at those subjective criteria. So just thanks everybody for joining. I think our time has run short on us is the problem. So thanks everybody for joining the webinar. We appreciate everybody's engagement. Reach out to your rural development field staff, your rural development state director, your rural development state office, your rural development community programs director. Use our community facilities email address. We'll try and get your questions answered as quick as we can.
All right, thank you.